Johnson. He's the Executive Director of Social Security Works. He's been a fill-in host for me from time to time, too. SocialSecurityWorks.org, StrengthenSocialSecurity.org are the websites. His Twitter handle is ALaw202 or SSWorks. And Alex, welcome back to the program.
Always great to be here, Tom.
Great to have you with us. So, geez, I don't know where to start. We've got 25 minutes or thereabouts that we can talk. Let's start out with Medicare and what's going on with Medicare right now.
Okay.
I had Congressman Pocan was on earlier, and a woman called in who apparently her physician slammed her into one of these ACO REACH programs. And she said that the company, the direct contracting entity, was refusing to pay for her medication. It was refusing to pay for her doctor that said she didn't need, whatever it was. And I was like, oh, you're on Medicare Advantage. And she's like, no, it's not Medicare Advantage. It's something else. And you want to fill us in on the whole ACO REACH thing and what's the status of this? And I know the Trump administration was pushing this really hard, and Biden apparently still has it going.
Yeah, it still exists. It's a really remarkably terrible. It's hard for me to formulate just how much I hate ACO REACH. Because what it is you got people who chose traditional Medicare. Maybe they know that they have complex health needs, or they just want the assurity that their care won't ever be delayed or denied, that no insurance company bureaucrat in a $6,000 suit is going to get between them and their doctor, or ask for a prior authorization or all these other things that are just a health insurance company's way of making money by hoping that you die. I know you know that, Tom, but I always like to make sure everyone does. When they delay and deny care, the way that saves them money is because they hope that you die and then they don't need to pay anything. They don't make money paying for health care. So ACO REACH is really terrible because it takes people who chose traditional Medicare and it moves them over into Medicare Advantage, often without them even knowing that.
And it's not branded as Medicare Advantage.
Right. And oftentimes people just don't know, right? Everything seems the same. And then all of a sudden they might go into their provider and they are asked for a prior authorization, which they've never faced before. And a lot of people don't actually ask the question why. They just figure, oh, this is just how our system works, because people on Medicare did go through the dumb system that we have with employment-based health insurance or individual market. So the times you hear about it, Tom, are only from the people who it happened to and who know and raise the alarm by calling into your show. So right. We know it's happening way more than we're hearing about. We know ACO REACH is right around 2 million people now. But I will also say the problem isn't ACO REACH in and of itself. The problem is Medicare Advantage in and of itself. What ACO REACH does is moves people over into Medicare Advantage, and that's the problem. The problem is corporate health insurers who have slimed their way into the Medicare population. They rip off the government, i.e. the taxpayers, with overpayments, and then they delay and deny care to the people, to the patients. They restrict networks so that, the doctors and providers that you want to go to are not covered. So, you think you are covered by Medicare, and then you find out you got to pay out of pocket for everything. Senator Wyden did a bunch of reports on basically scam Medicare Advantage plans that have ghost networks. They're literally pretending that they do something, but none of the providers that a person would need are actually in their network. That's just fraud. That's just a scam. And also what we're seeing now with Medicare Advantage being 51% of the Medicare eligible population are now in private plans. All of the bad things that they're they're doing more of them, and they're doing them worse, right? So they're delaying more, they're denying more, they're restricting networks more. And we're seeing from the provider side, providers exiting. They don't want to fight with Medicare Advantage anymore. So they're saying, oh, we won't take Medicare Advantage. Now, a person has no say there, right? They can't then just switch over to traditional Medicare. So it's really a catastrophic situation that we're in, and it only gets worse, Tom.
I understand that the Biden administration's HHS secretary, that's Javier Becerra, if I'm remembering correctly, is a big fan of ACO REACH. Do I have that right?
No, I wouldn't say Javier Becerra is a big fan of ACO REACH. I feel like so Javier Becerra has a long history of actually saying that what he needs to do is level the playing field between traditional Medicare and Medicare Advantage. And there have been some moves by HHS to do that. Not enough, but actually significant. And also, Tom, as you know, the only time that anyone has actually done anything to address both the overpayments and the underdelivery with delays and denials. I think what's happened with ACO REACH is that there is a legalistic mindset in one big faction of the White House, and they were very concerned about the rest of the part of government that ACO REACH exists in, called CMMI. Sorry for all the acronyms. But what they were really worried about is that they had a contract with these providers and they didn't want to break it. And so, which we think is a very thin explanation. And, when you're talking about the health, well-being, and lives of millions of Americans, it doesn't hold any water at all. But I think it's more coming from a faction that really are very small c conservative in their thinking about what the government can do on these contracts. And I will say that's a disastrous mentality, Tom, because that's what leads to the idea that every year there's a report that says Medicare Advantage plans are ripping off the taxpayers and improperly delaying and denying care. But there's never been a real enforcement action, i.e. none of these plans have ever lost their contract, because it's like the government is scared to actually enforce a contract on a corporation. It's like the exact opposite of the way that things should work.
Is this regulatory capture? Is this that you've got a bunch of people at HHS who are hoping that they'll get $1 million a year jobs with the insurance industry when they leave or something?
I think it has to be something of like regulatory capture, an iron triangle. The Eisenhower warned of the military-industrial complex. If you sort of Google and look into what that is, it also is about creating a constituency. So with 51% of people who are Medicare eligible on Medicare Advantage, there are also a lot of people who believe they love their Medicare Advantage program.
Because they've never gotten sick.
Because they've never gotten sick. That's exactly right. So they think that they're getting like a great deal, right? Because it is a great deal if you don't need it. But if you do need it, as soon as someone tries to access it, they realize that they've been sold a bill of goods. And you can see this actually if you look at like who signs up for traditional Medicare with costly supplemental plans. That's what rich people in this country do, because they know that's the absolute best situation you can be in for healthcare if you're Medicare age. Now, what we have to do is actually make that second part more accessible, right? So I don't want to put the cart in front of the horse, but it's really possible to take those supplemental programs, the Medigap, and subsidize them, create a public option so that every single person has the ability to get that same level of traditional Medicare with wraparound services. And importantly, Tom, no one would then be locked into a killer plan. And that's something that can happen now. You could find out that you are on a scam Medicare Advantage plan and you couldn't switch over to traditional Medicare everywhere in this country because of a thing called, there's a lack of guaranteed issue. The Medigap don't have to give you supplemental insurance. So it's really a disastrous and explosive situation that the Biden administration is a little bit whistling past, but also is doing more than, the Obama administration did, more than the Trump administration. Obviously, the Trump administration was going the exact wrong way, trying to get as many people on Medicare Advantage.
But Alex, you can stick around with us for a little bit, right?
Oh, yeah.
Okay, hang on.